In this tutorial, we will cover the patient registration screen. To access the patient registration screen, click Navigate, open your Perfect Care EHR folder, and then select Patient Registration. In the screen, you can edit current patient information and also add a new patient. To add a new patient, you can simply click the new icon at the top of the screen or type in A and tab and the account number. To access an established patient, you can do this by clicking the open icon, clicking the binoculars, or your F3 key will bring up the search. You're able to search for a patient by their last name, account number, first name, date of birth, etc. You can also change the search type from starts with to contains or equals. By clicking Find, it will list all patients in alphabetical order by their last name, since I have that as the search column. I will select my patient, telephone number. You have the opportunity to add cell number and other multiple telephone numbers. You can also add a patient's email and multiple emails. As you add numbers to these fields, it keeps track of the numbers in a list form. And the same with email address. The second address is so that you can enter in an additional address. If their primary address is a P.O. box, this is a place to enter in their street address. You can also use this field if a patient lives out of state for part of the year. You're able to enter the day and month, so when the patient leaves and when they return. That way, if you send out a letter or patient statements, based on the date you're sending it, it will put the appropriate address. The next section is additional information. Here you will enter their gender, birthday, and social. You have the opportunity to enter marital status, employer status, and employer. Patient status is required to be a 1 to schedule appointments, add charges and payments. Financial status is optional and is a good tool for reporting. The only thing is if you use self-pay or insurance only, that is what the account will be classified as. So if self-pay is selected, it will not bill the patient's insurance even with insurance information entered. And insurance only, when the insurance pays, the person posting the payment will get an alert to write the patient balance off. All other financial statuses are added by the client and can be changed and deleted. Ethnicity, race, and preferred language are all for meaningful use and entered if you're trying to meet meaningful use. Chart complete is if you use our document management system. You can mark the patient's account that the chart has been completely scanned in. That way staff will know that the chart is no longer a paper chart. Alternative account number allows you to enter an additional account number if you have one from possibly another system. Patient photo allows you to take a picture and insert it of the patient into their registration screen. More patient allows you to enter in date of death, signature date, which is typically the date the patient first came to your office and filled out their paperwork, and can be changed, and reports can be ran based on appointments to let you know who needs to fill out new paperwork. Also here you can enter in a maiden name and defer the patient's insurance. If you have insurance information in the system for the patient that you do not want to delete, but they become a self-pay patient for a while, maybe doing cosmetic treatment, you can defer insurance claims and enter in a date for that. That way you're not having to delete the insurance. Notes is where you can enter a note, either a note regarding the patient or a note for the staff. And these notes can be set as a pop-up note in different screens. So if this account is opened, the staff member will get this note letting them know that you need additional information. You can add additional notes just by clicking the star. When you have multiple notes in the system, you can look at them in a listing format. You can also set the note to a category. So if you ever need to run a report based on a note, you're able to run just those notes that you need. The Contact tab allows you to add contacts for this patient. By clicking New, typing in the name, entering the relationship, and telephone number. And you can do multiple contacts also. And see them in list format. In the Patient Billing tab, you're able to defer a patient's account so that a bill does not go out, or set up a budget or payment plan. Also here shows the patient's cycle date. Cycle date is based on the first date patient gets a bill, and then every 28 days if your cycle date is turned on for patient billing. This will show you when the next patient statement is due to go out when you have cycle date turned on. At the bottom of a patient statement, you have the opportunity to have dunning notices to print. You can turn this feature off by selecting No. When dunning notices are on, it will print the system dunning notices. These dunning notices can be changed. Retain current dunning notice when it is set to No. That means if a patient makes a payment on their bill, then it will go back to the first dunning notice, which is typically this is your first notice of your bill. If you select Retain, no matter how many payments they make on the account, it will retain the current dunning notice, such as your account is past due. And in patient statements, you can set up a patient statement based on the patient. There is the same settings in system, but if you need to change a setting for a specific patient, such as they want to see their diagnosis on their statement, you are able to do that. The case and insurance information area is so that you can add multiple cases. Cases are typically used if a patient has a motor vehicle accident, a work comp accident, a slip and fall. When you add multiple cases, you're able to set different insurances to bill for those type of cases, or a different responsible party. To add a new case, you click the drop-down, do New Case. You assign the case type, such as workman's comp, and then click OK. You will then see that it clears and gives you areas to add new information. In the provider field, this information would be which provider they see in your practice. Referral would be the doctor that referred them to you. Diagnosis 1 and 2. Facility where you typically see the patient. And location would be which location they are a patient at or their chart is at within your practice. So the office or the Tampa office. Open date would be the date that you open the case, and again, you can click T in the date field and it will automatically put today's date. When it is a work comp or motor vehicle, you have to put in an onset type, such as employment or motor vehicle, with the onset date. So this is where you would enter that information. Any information entered here in the case information will pull into the charge screen. Under More Case, you can add additional diagnosis, other provider, other referring. Other referring maybe if you track how patients are referred to you, such as television, commercial, billboard, internet. You are able to enter notes for a specific case, hospitalization information, which does not pull over into the charge screen, keep track of disability information, and extended data that needs to go into the charge information. To add the insurance to the case, you can click the binoculars or in the insurance code, hit F3 on your keyboard, and it will bring up your search engine. Type in the name of the insurance and click Find or Enter, and then select the insurance. When entering a policy number or group number, you never want to enter any spaces, as you see here, or dashes. This information, symbols and dashes or spaces, cannot appear in an ANSI format for electronic billing. So you want to make sure everything is together with no dashes and no spaces. You're able to enter the patient's copay and enter a subscriber if it's someone other than the patient. The easiest way to enter a new subscriber would be to click in the subscriber field and click the F2 button on your keyboard. That will pull in the patient's information so that you do not have to re-enter the address and telephone number and last name. You do have to enter the first name, correct the gender, and enter in the patient's date of birth. And click OK. Active date would be the effective date of coverage, and expiration date would be used when you expire the insurance. The relationship would be the relationship of the patient to the insured. You also can scan an insurance card by clicking here to Scan Card and Scan Insurance Card. If you're using a duplex scanner, it will scan in the back and the front of the insurance card. And this can be done with each insurance. Now that an insurance expires and you need to move it to the second place, you would just right-click and move insurance down. That will move the insurance company to place number 2. You can also remove the insurance completely by right-clicking on the insurance and clicking Remove Insurance. To track authorization numbers or approval numbers, simply click on the Approval tab. And to add, click the star. Enter the authorization number here, the effective date, I'm going to do T for today, the expiration date, and how many visits were authorized. You also want to use the comment section if the authorizations come in for different reasons. So if you get an authorization number for visits, but then you also get an authorization for to do special testing in your office, such as MRIs, you want to note that in the comment section. When it is noted here, the person entering the charge will see a drop-down letting them know that there's multiple authorizations, and they're able to select the correct one based on what they're entering a charge for. You can also see them in list format. This concludes the tutorial on the patient registration screen. If you have any questions, you can forward them to questions@ncgmedical.com or call the support helpline at 1-800-330-1906. Thank you for your time.